So, a very good evening to all of you and a very happy Teachers' Day. On this platform, I would want to express my gratitude to each and everybody who has taught me formally, informally, actively, passively, or has been, an inspiration for me. Because I think when we say that we learn from the mountain and we learn from the tree, even not only the living things, the non-living things also teach us. So everybody is a teacher if we really want to learn. So today, Candid Talks is an initiative of a venture of mine called Priceless Parenting, which believes in appreciating, accepting, and celebrating uniqueness in each child. So we have been taking therapeutic sessions for children with special needs since many, many years. And recently we have launched our online program also, which is Pan India and have seems to be successfully running now. So today's discussion is on developmental monitoring, screening, and evaluation in children. You all know that Rome was not built in a day. And I think we can say this, the same goes for the brain because brains are built over time. And the basic architecture of brain is constructed through an ongoing process that begins much before the child is born and continues till adulthood, continues throughout the life. Center for Developing Child 2007, the Harvard University, it reconfirmed that the early experiences that the child has in life have lot of impact on the architecture of the brain by establishing either a very sturdy or a very fragile foundation for the learning, for health, and for the behavior that follows. Most of us know that in the first year of few years of the life, more than 1 million neural connections are formed every second. And so many scientists now know that the major ingredient in the development of the developmental process is called serve and return. When say serve and return, it means serve and return is a relationship between the child, the parents, the community, the caregivers, because what you serve, you get in return. So it's an ongoing process in the transaction between the child and the environment. While every child is an individual in himself or herself and develops at their own pace, there are some known periods or some windows during which most of the children achieve certain milestones in their lives. So to understand what are those milestones, what are those windows, how do we identify them, how do we go about it, we have wonderful experts with us who have been doing this process since many, many years and been helping a lot of parents day in and day out. So I welcome Dr. Sunita Manchanda and Satinder Kaur Walia for the discussion on Candid Talks. Welcome both of you. Before I give an introduction, you can just say.
Thank you. Yeah. Hello to everyone and happy Teachers Day.
Satinder, you can also wave and say hi.
Yeah, hi. Hi, everybody. Happy Teachers' Day to everybody.
Okay, so let me just give you a brief introduction about the wonderful panelists we have today. Dr. Sunita Manchanda is the adolescent pediatrician, Max Hospital, Gurgaon, and consultant pediatrician for a charitable hospital, Gurugram. She is also a master's in psychology and she has 20 years of working experience in India and UK. She is a trainer for course Child Sexual Abuse Prevention and Response and also a trainer for Poor Scholastic Performance Program. She is a master trainer for life skills education and a state coordinator for IAP, NNF, NRP, FGM project, although I don't know the full form, but she conducts awareness workshops for parents, teachers, and students on parenting skills, adolescent issues, nutrition, stress management, time management, life skills, family life education, and so much more. She's involved in research projects associated with adolescent health and presented papers in national and international conferences. We are really honored to have you with us, Dr. Sunita, here on this platform today. Our second panelist is Satinder Kaur Walia. She is a child psychologist with 20 years experience in working with individuals with disabilities, both in India and as well as in USA. She received a master's degree in psychology and that to dual master's degree, one from Delhi University and the other was in school psychology at University of Central Oklahoma in USA. Presently, she is a visiting consultant at BLK Super Speciality Hospital, Pune, and Max Hospital, Gurgaon. She is associated as a visiting school psychologist with the British School and as a mentor with Matri, a health application. She is also a clinical advisor at Mom's Belief. She has worked with many schools like the Heritage Experiential School, Shiv Nadar School, Continue Kids Clinic at Sushant Lok, and I Rocket. I think I'll have to conduct webinars to talk about these women, with so many degrees and so many credentials to their existence. So I welcome you both, and I'm very sure that your experience will benefit the parents in being more alert, being more aware, and being more progressive when they are dealing with their children. So, welcome you both. And before we start, I would want to have a poll. Can I have your permission to get that poll going?
Absolutely.
So,
Yeah.
for parents, we have parents, teachers, whoever is there as participant. I am going to launch a poll. Just respond to me in few seconds, and we'll share the results with you. Okay. So, the first poll is, okay, how important is it for parents to be aware of different aspects of development of children? Do you think it is very important? Do you think it is important, or do you think it is not important? This is only to come to the same page with you so that we can carry on the discussion, knowing your mindset and knowing your views about it. I'm going to end the poll soon, so please hurry up in responding. We have 41 people out of 52 who have responded till now. I will appreciate if you can vote more. Okay, so here I am ending the poll and I will share the results with you.
93%.
See, 93% people say that it is very important to be aware of different aspects of development of children. 7% say that it is important. I'm so glad that nobody said that it is not important. I'm really happy to be among such aware, people around me. So I would start with a small saying that an author, Jess Lyer, said. He said that children are not things to be molded, but are people to be unfolded. So let us unfold the development through the eyes of Dr. Sunita and Satinder both. So before we discuss that, who does the developmental policing, what needs to be done, how we go about it, I would first want both of you to explain what do these terms mean. So Dr. Sunita, I would want to ask you first, what do you mean by developmental monitoring and screening?
Right. Am I audible? Am I audible?
Yes, you are. Yes.
Hello?
Yes, you are audible.
I am audible, yeah. First of all, I would like to thank Dr. Vinita to you for creating this a very important platform to bring us together and for this an important talk. So thanks to you first, and congratulations that you wish you all the best for that as well. And to all the parents, I would say good evening, and also that we all are here to learn from each other. As we had said that this is a Teachers' Day, Happy Teachers' Day. Teacher can be anyone. It may be, for us, it may be a patient also, parent also, and our friends also, and of course the teachers are. So here now coming on to this very important topic, as you all said that it is very important to know the developmental. Now there are the three terms which are being used separately. One is called as developmental monitoring. That means observing how your child grows and changes over time, and whether your child meets the typical milestones, whether it is in playing, learning, speaking, moving, etc. So what does it mean is that initially what happens was there was a joint family system, and even in the one family there were 3 or 4 kids were there. So generally in the one family चाचा भी हो गए, ताया भी हो गए, तो इतने सारे लोग होते थे कि वो बच्चे की डेवलपमेंट प्रोग्रेस भी देखते थे, प्लस बच्चे भी बहुत सारे होते थे, तो वो देख रहे होते थे कि ऐसे बच्चे ऐसे से progress करते. But nowadays what happens is it has become a nuclear family, and somehow mobile is also taking or playing a very important role in family. So it has become very much important for these nuclear family parents to know whether their child is growing well or not. Now they will be able to know only then once they know what is normal. So developmental monitoring is basically, it can be done by anyone, maybe a parent, grandparent, or even sometimes I remember an incident, it has happened with one of the maid, which he used to massage the baby, and then he tells to the parents that देखो इसकी जो legs हैं वो थोड़ी सी tight हो रही हैं. It is not the normal massage जो ऐसे हो रहा है. Later on it came out to be a kind of a brain disorder which we call as cerebral palsy. So that is, the parents should be vigilant enough to know that yes, something is not normal first of all, or they may seek the advice of their pediatrician or someone so that they can know what is the normal development. The screening, coming on to the screening becomes a little more vigilant observation, especially what happens when the parents have some concern. They'll come to the doctor. The first time the doctor which they come is the pediatrician. And pediatrician, then what they do is either the concern is from the parent, or generally pediatrician do it during their assessment once they come for the vaccination. Then they grossly check for, okay, something is abnormal. And if they find yes, there is something abnormal, like if child is not able to sit by the age of 1 year, say, so then they do is a kind of a little assessment in the form of a questionnaires. Either the parents are being given a question, we ask them, or sometimes when we know there is a family history of the child has been in the NICU or has a kind of a perinatal insult, means delivery के time पे कोई problem आती है, तो उन लोगों को 3, 6, 9, 18 months or 20 months में the pediatricians can do the observation with these kinds of screening. And if parents are aware, I do not know whether they are aware, but आजकल ADHD and autism के बारे में बहुत information हो रही है, and media also gives that information. These are the things जो कि हम लोग एक टिपिकल एज पे लाइक 18 मंथ पे ऑटिज्म का हो जाता है, 3 इयर्स पे ADHD अटेंशन डेफिसिट डिसऑर्डर्स बोलते हैं, उसकी असेसमेंट एज ए डॉक्टर कर लेते हैं. नाउ दिस असेसमेंट से हमें पता लगता है कि यस, दिस चाइल्ड इज नॉट गोइंग इन द राइट डायरेक्शन. कोई किसी भी फील्ड में, चाहे वो लैंग्वेज का फील्ड है, चाहे वो उसका अंडरस्टैंडिंग का फील्ड है, चाहे वो उसका फिजिकल है, चलने और मूवमेंट का है. तो बट वंस वी फाइंड दिस that there is some problem which we are okay, there is a doubt, then we refer them to the further developmental pediatrician or the child psychologist for a detailed evaluation, so that we can get a final diagnosis कि क्या problem है, किस area पे work करना है. तो then a formal एक assessment हो जाती है, that is called as a development evaluation. So this way we progress, or we see and explain the parent about the development of the child.
Wonderful, wonderful. Very nicely explained. So now we come to you, Satinder, that, she has done the first part. What is developmental evaluation exactly?
Yeah. So first of all, thank you very much for having me on this panel. And I'll continue. I'll take it from what Dr. Sunita has left, that after screening or after parents have reached to the team to see in the development clinic that what could be the cause, whether the delays are prominent also. Sometimes we need to see if there are only developmental delays which are looking like a for example, as she mentioned, these days there is less stimulation from the parents. A lot has been given. The child could be actually spending a lot of time with the help or the maid, or sitting at home and not being stimulated. The access to the screen as early as at a 1 year of age also kind of is enhanced, like, not helping the children develop, because children learn through imitation. So if there is no person interacting with the child one-on-one, whether it's a parents, caregivers, or any other thing. Sometimes if the person, there are grandparents at home or there is extended family, the children will have access to that stimulation. So sometimes the delays could be just because of the environmental. But if the delays are prominent and they look like as part of a developmental disability, so in evaluation, basically we are looking for that what could be the cause of delays. Is it just because of the stimulation environment, or it could be some syndrome, it could be biological, or we look at it could be something which is looking like some of the developmental disability, like she just mentioned autism, ADHD, So if a child comes to the development clinic and is having a plain speech and language delays, and if a child is almost 2.5 years old, and if we are seeing the language delays does not seem to have impact on other aspects of the development, for example, on the social emotional aspects, the child is able to communicate, then we are only focusing our attention on the speech and language aspect. But if the communication as a whole is delayed, and if a child is not even interacting with the caregivers and is totally lost, self-absorbed, and have other features like repetitive behaviors, then we look at more from the perspective of autism. So in evaluation, basically, it's not only about measuring the development. It is basically to see what are the levels of development, how much prominent the delays are, and how intensive the interventions are required. So for example, which intervention is going to help me the best? If a child has cerebral palsy symptoms, then maybe OT has a very prominent role in that, and then the other aspects. But if a child has autism, then both OT, speech language, and the team works together. So the development evaluation actually looks at what could be the cause, what is it the level of delays, whether it is fulfilling any developmental disability level, and what interventions can help for this child to catch up and meet the levels of the delays what the child is having.
Very well, and I understand, that nowadays, because people have a very superficial knowledge that yes, these symptoms, and you can label the child. So I think before anybody else labeling, the parents start labeling, the teachers start labeling the children that no, he's an ADHD child because he runs a lot, or autistic because he's lost. But I always suggest, and I always say, it is always better to go to a professional and get a proper assessment and evaluation done, because people are in so much hurry to label, which is absolutely wrong. Sometimes those delays are very natural and the children get over it. So I think we really need to stress on that fact that be vigilant, as Dr. Sunita also said, and you also said, we have to be extra vigilant. And whenever there is an issue, or we see that there is a red flag, we have to go to the right professional. So here I would like to ask you, Dr. Sunita, that what are the developmental milestones you think a teacher or a young parent should be aware of, and what are the red flags that they should be screening their children for?
Right. So here it is, as we were talking about, that very important to know this developmentals. As you rightly said, pointed out, that sometimes क्या होता है कि बच्चा ठीक भी है. For example, nowadays their milestones are coming up a little early because of too much stimulation, or we can say, or maybe a little late also because of lack of stimulation at various places. So कभी कभी क्या होता है कि they compare the parents, and 10 महीने पे किसी का बच्चा चलना शुरू हो जाता है और हमारे पास आ जाते हैं एक कि हमारा बच्चा तो अभी तक 11 महीने का हो गया, चलना शुरू नहीं हुआ. सो इट इज वेरी इंपॉर्टेंट कि अगर बच्चे 1 साल पे भी चलना सीखते हैं वो भी नॉर्मल है, और अगर 10 साल पे 10 महीने पे भी होते हैं तो भी नॉर्मल है. So going into that a little bit, not going into much of the details, but I'll give you important points which as a pediatrician I can teach, but as a parent which you should be aware of. कि 4 categories में we see these developmental milestones. One is the physical milestones. Second is the fine motor, means gross motor milestones. Then fine motor. Then come personal social, and fourth comes the language. Language is very important, which is most of the time is being ignored because of not knowing what exactly is it. So as Dr. Vinita has also explained, that this is a brain. Now the body or the human beings, they grow with 3 things: the brain, which gives them a signal; the body, which follows the signal and uses its power; and the society or the social environment through which they learn. So which we have to categorize or see the importance of the coordination of these 3 things. So like for example, if we grossly I tell you, if a normal child at the 3 months, it should be able to kind of lift his chin. If he is being lying down position, तो in a prone position कि उल्टा हम लेटाएंगे तो थोड़ा सा बच्चे को chin lift कर देना चाहिए. That is at 3 months. 4 and 5 months में roll over शुरू हो जाता है. 5 months में he should be able to sit with support. थोड़ा support दिया तो बैठना शुरू हो गया. And 8 months तक we say कि without support he should be able to sit. Then 10 or 12 months, 10 months में he should be standing with the chair or standing with the table, and 12 months में he should be able to walk with support. 1.5 years तक okay, he should be able to walk, and 2 years maybe should. If I am not fast, is it not too fast now, or is it
No,
okay?
it's perfectly fine.
So, okay. So at 2 years, he should be able to walk stairs. If you can remember this, it's fine. If not, even the mota mota ki sitting should be by 8 months, standing by 1 year, and walking by 1.5 years. So these are the kind of things if we can remember gross. Coming on to the fine motors means the hands coordination, our smaller fingers, so, these kind of a skill work. In that case, we will say we generally test this by giving the things to the baby, okay, whether he is able to catch hold of these things. This tells us that okay, development is normal. The size of the thing will reduces in size. For example, if he is able to catch hold of the rounded rattles, especially red color is, which we prefer, it should be at he should be able to try to grasp it at 1 month. Then there is like a cube, if it is to be given, it comes at the 5 month, and later on 9 month में this we called as a pincer grasp कि एक finger और thumb के बीच में अगर उनको कुछ पकड़ने के लिए pellet भी दी जाती है गोली सी, he should be able to do that. This comes under the fine motor. Then comes the social. Social means the interaction of the child with the mother. Like mother speaks of something and the child responds, which normally is called as a social smile, which child should be able to do it by 2 months. Similarly, 6 month pay, there should be element of stranger anxiety. Before 6 months, it's okay. The child is able to go, whosoever hold it. 6 month के बाद they see okay whether this face is I'm able to recognize or not, because the mother recognition comes around 3 months. Initially 2 month पे social smile होता है, 3 month पे mother recognition, and 6 month पे जाके they are kind of a stranger anxiety कि किसी stranger को देख के they will react differently. So this comes under the social system. Then the language, yes, it is very important because most of the time हमारे पास problem आती है, the child is not hearing 3 साल तक, then they come to us because parents do not even able to understand कि they do not get the clues कि क्यों नहीं सुन रहा है, या कई बारी क्या होता है कि they are not hearing some part of it, parents are being loud और TV वगैरह loud हो जाता है, तो they are able to catch up in the beginning but later on they are not able to listen. So in that case the normally babies, what rule of 4 we will generally say कि one word should be less than 1 years, two word जो है वो 2 years, and 3 word sentences at 3 years, and 4 years पे he should be able to make the sentences. तीन चार word वाला sentence he should be able to make this. That is the one which we say. Coming on to the, these are the grossly milestones, but important for us is knowing it flag signs. Flag signs is कि upper limit हम कितना वेट कर सकते हैं उस बच्चे का कि अगर उसने first of all these red flags, there are two important points. If there is a history of a mother having kind of giving birth to a baby which is a preterm to admission, these should ideally be assessed by not even by pediatrician but also developmental pediatrician at age of 3 months, 6 months, 9 months, and 8 months. So if there is a history of admission of the baby after birth, definitely yes, number one. Second is, if there is a no turning to the sound at all, even at 3 months, baby is not able to turn his head to the sounds, definitely, and means not developing a social smile. He is not responding to the smile. That is a red flag. So no social smile by 3 months, definite indicator. Then there is a no word by 18 months. If the baby is speaking blah blah, it's okay. But if 18 months we see the child is not at all able to speak a word, definitely he should come to the assessment. Then if there is not able to sit by 1 year, we can say, or if the child is not able to stand by 1 year, as I already said, are the red flag signs. And more important, few things different from is, if you notice a child is having single hand preference, like for example कि एक ही बार less than 2 years में he is using एक हाथ को ज्यादा use कर रहा है एक हाथ को, normally these kids do not have the hand preferences, so that's a red flag sign that yes, definitely they should come to the assessment. come and show it to this. And another important thing is, if the child has कि वो बोलता था पहला but बाद में बोलना कम कर दिया है, definitely they should come and seek, and then we'll have a formal evaluation by the Dr. Walia, I would say, so that they can find out where the problem exists. Yeah.
So are there any screening tools that can be used by a parent, or the screening tools that you use with these children?
Yeah, we use it like when they are coming us with some concern, or whenever we know that there is a risk factor in the mother during delivery or child is preterm. Three types of this we normally use is, this is called as a Tremendum Developmental Child TDCS screening tool for children 0 to 3 years, which has got a physical and fine motor, as well as there is a separate tool for the language. That is the one. And second, we are preferring, nowadays we have started because of autism and ADHD, and we have been hearing a lot of from the developmental pediatrician that no, we should get that assessment. So we are trying to do that assessment of at 18 months of autism, and screening for ADHD, not as proper assessment, but screening, I would say, for autism at 18 months and at 3 years for ADHD. Or if there are any concern from the teachers or from the school teacher, they say, then yes, we'll go for that screening.
So, Dr. Sunita, sometimes, the parents might come to you, and definitely in screening, you see that there's, you detect that there is a clear-cut problem somewhere. So, in these cases, how challenging do you think it
Yeah.
is to convince the parent, and what are the suggestions that you generally give them?
Yeah, it is actually quite challenging. Even being in, getting this psychology also, I find it quite challenging, because somehow, if it is a physical milestones, they are still okay. They are okay, I'm saying. They're not that vigilant enough. If you say, कि नहीं ये ठीक नहीं लग रहा है, and I am like finding okay, tone is also increased, कि बच्चे की legs मुझे tight लिख रही है, clearly I know that there is something wrong. But still I am not able to
आपकी आवाज चली गई. Dr. Sunita, there's some problem with your internet. Till the time she comes back, Satinder, can I put a question to you?
Absolutely.
Okay, so in which cases do you think that evaluation is a must and is required when the screening is done by the pediatrician?
So again, as I mentioned that, once this,
but उनको बता
I think we're getting her back.
I think there's an internet issue with her.
Yeah, there we
Dr.
are.
Sunita, are you back?
sorry, I think it got a little
No, it's
disconnected.
okay. It's okay. You can continue. Then I had posted a question to her. You can continue. Yes, please.
Yeah. So even if we tell them to go to therapist, and third is like they start putting a blame on each other. Like husband will say to the wife, अगर उनको समझ में आ भी गया है, they got it that there is some problem, they'll kind of blaming each other. It is because of you. They will not, they do not understand the importance of early intervention. That is the one I feel. And secondly, sometimes another challenge is they are ready. Okay, they went to therapist also. Somehow they are not convinced there that okay, what they are doing the right thing. That's also challenge we face. But I think in between challenges we find a little bit of parents, few parents of course there are, who follow the regular advice, and they go to the places also where we tell them, and definitely get a good results. So it's quite challenging to convince them, and especially first of all making a diagnosis and then getting the treatment done. Definitely we face quite a lot of challenges.
That was a wonderful insight. And Satinder, before we start, can I just use another poll for the parents to see how alert and engaged they are?
Absolutely.
Yes.
Please go ahead.
So I'm going to launch another poll.
Yeah.
I think I am not getting it right. Just give me a second.
Vinita ma'am, you are on mute mode.
I'm so sorry. So the next question was, are you open to seeking help if you detect a red flag in your child's development? So Dr. Sunita has told you about certain milestones and the red flags. So would you be open to seek help? So 56%, 57% of the people have voted. 59. Okay, so 70% have voted, and I wish to end the poll now. And I will share the results with you. So 93% of the people say that yes, they are open to seeking help. 3% say that no, they would not seek help. And 5% say maybe they might seek help. So, Dr. Satinder, I want to put the question to you now. Where and when do you see that evaluation is important? What would you suggest to the parents?
So I'll, few points I wanted to add what Dr. Sunita already mentioned. I feel that, I have seen a recent trend has changed. Rather than only somebody convincing parents, I also see parents actually doing a lot of their own research and coming out. There are a lot of screening milestones which are available online. CDC has a really good milestones. Trivandrum is online. So I think a lot of parents sometimes, if there are language delays, they Google themselves and then they find people around, and some good points of internet, they are started reaching out for the help as early as possible also. Having said that, there are many people who are reluctant, and even after a lot of convincing, they continue to be reluctant. So I think it's a mixed bag, but over the years, in last few years, I've suddenly seen the younger generation, new parents, they are well read and they are wanting to seek help. So one disadvantage of nuclear families is that we don't get access to understand the development of the children. But the other advantage is that these parents are well read, and anything if they notice or they come to know, they are just very quick to look for the information online and then go and seek help. So I think everything has its own benefits and like areas of challenges. So now coming when the evaluation is required, if you ask me personally, in developed economies where these services are by the state and they are free of cost, then every child gets a mandatory screening and assessment done. But working in India has taught me one thing, that when parents come to us, they might be coming for a help. So it's not the assessment or the evaluation which is more important, because spending time getting the assessment done by interviewing them and just giving them a report saying your child has moderate delays or severe delays, I think then we've not done justice to the child or the parent. So I personally think evaluations are just to measure their development, again to see what are the lags, areas of lags, and what interventions are required. The evaluations help us to measure and to see the progress. So if I have tested a child at 3-year-old and if I reassess at 4-year-old, I can measure the progress. So it helps me to document, it helps me to see what tomorrow after the intervention, whether the child has shown the improvement or not. If the school admissions are being sought, if there is something I am seeing that there is more developmental disability, I need to look into maybe autism or other things, then it needs to be documented. But most importantly, as part of the evaluation is to sit with parents, discuss the development, explain what the results are and explain what milestones, and give them the idea that what early intervention can do. And I think not to scare the parents, but to let them know that if interventions will not be sought, then where it can lead to. We cannot predict what is going to happen, but giving them a good picture that where it can lead to and what can be changed. Because sometimes, many times, especially with autism, parents will ask, Mera bacha theek to ho jayega. That answer you as a clinician or profession cannot say. But I definitely would not want to say, give them a data that, okay, 1 in 100 child has autism and it is a lifelong condition that they already know. I think as a professional, my job is to reassure them that if we will work hard, we will try and help this child to reach to its potential. So, and nobody can predict. Early intervention has shown really good results. So, giving them hope, working with them together, and letting them know that we will be part of the process and, be available for them whenever they need you. I think that is more important than only getting the assessments and evaluations done.
Absolutely, that is so right. But sometimes what I see is that parents come so well read. I mean, they have done their research on the Google, and but they are in a kind of a fear psychosis, because the similarly the question that you said, that the first question they ask is कि मेरा बच्चा ठीक हो जाएगा, because they are so overstrained and overstressed with the information that is available. They try and connect puzzles, they try and connect pieces, they try and connect every piece of information to their child, and I somewhere feel that that is wrong, that is not right. So how do you think, is it fine for the parents to go through the Google, or they should just blindly follow what the developmental pediatrician or the psychologist is saying?
So if you ask my personal opinion, I am not against anybody researching on internet. I think as a professional, my job is whatever research they've done to give them good sites and let them know what the research is saying. And maybe what research is saying to provide them that research journal rather than what they have come across parent chats or things like that. So I am not against, because if I get some diagnosis, I think I am going to go to Google. It's my body. If any interventions has been recommended to you, I am going to do a research. So when people say that don't go on internet, I feel very reluctant. Why shouldn't I go? There is access of information. I may not be the right person, but then that's why I go to a professional who can help me to differential diagnose and help me answer my queries. So if as a professional I have not helped and answer the parent query, the difference is that I know more than internet. So I know more than internet as in this field. So I need to convince the parent. I need to win their trust by letting them know that I am aware of what all is available. And that's why we do professional growth and professional development. Having said that, there is always the other side of the story. Internet can go either way. If I am not convinced on certain thing, I can pull out information based on that. So it again, if one is so convinced, then one can sit with the internet diagnosis. Then we don't need to reach out to the professionals. So I would respect all professionals, but at the same time, as a professional, I would not expect my client not to go on internet and have their research done. So that's my personal opinion, and you can say, or Dr.
But
Vinita
yes,
can say.
definitely, they should not get into that fear, because there's so much to it, and they should focus on their child's needs and progress instead of, generalizing things according to the reports that they read. So, second thing I would want to ask you is that we see a trend of, so many disabilities, difficulties increasing day by day. So, what are the main things that you think are increasing? Why do you think? What are the causes? What could be the causes for all this problem?
I think there are many things which are listed and what research is saying, but I also see the prominent reason is also the more awareness, and we are becoming more aware, and we are actually able to catch developmental disabilities much early on. As you see, the developed economies, the most focus has been that if you catch the developmental disabilities early on, then it will be less burden on any country rather than having a full-blown disabilities and having individual and then giving funds to that. So I think one, definitely more awareness, but as the research has shown and what we are seeing, the autism is definitely on rise, and I think nobody has got the conclusive answer. Definitely some changes in the environment has led to that, but some of the other factors, the environmental factors, I think more and more children with neurodevelopmental or early neonatal history are being saved, children with very low birth weight and a very strong history where they had NIU stay. So that could be part of it. And I think the other part is also the dynamics of the families are changing. We are also seeing less stimulation, and I personally feel that we really need to, like, the way your name of the organization is, we really need to connect with the parents and tell them that how important it is to talk to your children. I personally used to get baffled earlier, but now I don't. When parents ask me, how do you play with children? Giving them gadgets and giving them toys is not playing with them, you know. So we definitely need to have, we need to sit with our children, especially the early first 2 years when a child is only learning from the caretaker. They review the faces, the emotions, the exchange of language. If there is no language stimulation, how can I expect? Language is only learned through the imitation. So I think lot of particular, all these scenarios can lead to more and more developmental disabilities.
Do you think
Diagnosis.
increase in screen time is also one of the causes?
So that's a very hot question, isn't it? The screen time increase. So I think in moderation, everything is good. I personally think screen can be a very good. Now look, all education is done on screen. So if there were always the sides, there is a good part of the screen if utilized. I think the vocabulary, the visualization, there are so many parts of the screen which can be used to um, increase the learning aspects, but definitely there are some guidelines to use the screen. I think, as I said, less than 2 years screen should not be used. Till 4 or 5 years there should be a caregiver along with the screen to tell child what is coming from the screen is not the real and what is the reality. And definitely above that, if it is a passive sitting and watching and playing games, the games are not addictive, but unfortunately this lockdown hasn't helped. Right now, anybody parent coming and talking about screen, I am not taking that question. What else do we have for kids to do?
Yeah.
So it's a increase of screen to some extent, but I think it's not only increase of screen of children, but it is also increased use of screen by the parents, because there is a distracted parenting. If I am not able to keep down my phone and spend good quality time with my children, then definitely they are going to have cause and factors for that.
Absolutely, absolutely. And I think very well you put that point across. And the other point that you said, that stimulation from the parents is very essential. I was reading about a study where they say that even in the early years when the child is babbling or just giving a social smile, they expect you to smile back and babble back.
Absolutely.
If we don't stimulate them, they think that it is not required. And
Exactly.
sometimes that is the cause of a delay,
Yeah.
because they think it is like useless, when I'm babbling, it doesn't hold a meaning. So we need to be so much in sync with what a child is doing and respond and reciprocate to, any kind of language. It can be verbal, it can be non-verbal, it can be gestural. We need to be in communication.
And having said that, I just add one thing, that many times we've started seeing children coming on by the age of 2 or 3 years, and there are significant social emotional delays. But when you look closely and you see that it doesn't look like autism, it doesn't look, and the only intervention, you tell them to cut down their screen, and you suddenly see a growth pattern. So yes, definitely when you say screen, it is having an impact on many aspects. So yeah.
And Satindra, when you generally, evaluate and give them a diagnosis, give the parents a diagnosis, that may be, let us, since we're talking about autism or ADHD, attention deficit, anything. What do you think is the, biggest challenge? And what do you think is the challenge if you face even after the, diagnosis is made and the evaluation is done?
I think again the biggest challenge for any parent, if I would be a parent too. So over the years, becoming a parent has helped me to understand the other part of the thing. I've become much more empathetic. I've become much more vigilant about my words and my mannerisms. I think, as I said in the beginning, also it's not about the diagnosis. It's about the how you are revealing the information to the parent. How we are. I'm not saying we are giving fake hope, but we definitely have to tell them that what all can be done to help this child promote. By just labeling the child, by saying that the child has this disability, I think that's the easiest part of it. So there could be many challenges. I think I expect parents to react in any form. Sometimes the worst I had seen is parent really getting angry and wanting to get aggressive with me. So it's but with if you just take from their perspective, I think it can be very very there is stages of development disabilities diagnosis. So I think over the years I do spend a lot of time with parents, especially when I give them the results. I do see that it can be very difficult for them to accept. So going through that and spending good enough time and be available to them. I think that matters a lot. So diagnosis, I think, is the easiest part, because when you are trained in development, after few minutes of observation, you can see a clear patterns of autism. So I think that is not the thing which is like, giving diagnosis too early without developing a rapport with the parent, without doing a good observation and giving a good scientific reason. If I ask them ki repetitive behaviors hain, parent will say nahi hote hain. But then if I've observed the child in my presence, and if I see repetitive behaviors are there, and then I can show them what repetitive behaviors are, because it's asking them what repetitive behaviors are, because a child might be hand flapping, they think he's excited. So I think just narrowing down to the questions and working with them. So it can be, I expect that there could be some denial. And if I feel that there is a denial, I do let them know that, this is what we are seeing right now. This is what we can do. And, you think about it and you take your time, and then we can always revisit this. So that, I think, giving them time to absorb a lot of information is also very important. Because see, with children, if I keep 5 or 6 appointments at a time, and if a child has been waiting for 2-3 hours, by the time they come to you, they might be sleepy. So if these things are kept in mind while doing the diagnosis, while doing the observation, I think that goes a long way.
And very true, parents are an integral
Excuse me,
part
madam.
throughout. While,
Excuse
I
me,
mean,
ma'am.
with evaluation or even with this intervention part, I think we as professionals need to work more with parents and less with children. And if we crack that, I think most of the things become very smooth for us. And
Absolutely.
thinking one question to what you just said was that, sometimes what I feel that when parents come after the diagnosis to me, sometimes they tell me, ma'am, we had gone, but the professional or the psychologist has assessed, has been questioning us. They asked us questions, we had to fill things, but they didn't do anything with the child. So they have some apprehension कि बच्चे के साथ तो कुछ काम ही नहीं हुआ, बच्चे को तो देखा ही नहीं. तो ऐसे में what message will you want to give to the parents?
See, I let the parent know. I think, again, sometimes we assume that parents know the process. If I go for certain procedure or something, I may not, or maybe I am read enough, I will go on internet and look at the details of the procedure. But I think letting the parents know and make them part of the process, I definitely would let them know that I did not had the opportunity to observe your child for that long time. You live with your child, how he feed himself or how he goes to potty, I won't be able to observe. So that is, development is usually measured using the rating scales and taking the history from the parents itself. Some of the tests like Bailey's and others are administered on children, but many times the developmental profile is filled by the parents only, and that is how the development is measured. And many times what parents would feel ki aapne to dekha nahi, aapne bol diya development delay hai. So let them also explain that we are measuring, if a child is 3-year-old, what your child is doing right now is compared to a 3-year-old. So sometimes parents get very confused कि नहीं ये तो बहुत change हुआ है, and of course child has changed. So then explaining them that the parameters are that if your child is 3-year-old and speaking only maybe one words or monosyllables, that is delayed. 3-year-old has this much vocabulary. So again, breaking down and explaining them what development basically means and what it measures. And when we measure on standardized tests, we actually measure them with the age appropriate or what that age child has to do. So again, it goes back to decoding information to them and letting them know. So yes, developmental assessment is usually done with a lot of parental interview and a very minimal of observations also, but it is not only the rating scale. I personally would advise the psychologist also not to only get the rating scales. I've seen people giving the rating scale of autism also to the parents and fill it. I think that's not a very, it has to be a observation based, and that's where the professionals have to fill the cars and the other things. So it cannot be given as a rating scale to the parents.
And as you said, earlier, that it is your observation as a professional, that the parent might say that no, he doesn't repeat.
Exactly.
There's no repeated movement, but you, in few seconds, you are a thorough professional, you come to know that there is a repetition in the behavior. So some things, the psychologist or the person who's assessing does not need to tell in words, but yes, silently, they are doing passively, they are observing each movement that the child is doing there. So here, there's another question that I want to ask you, that once the evaluation is done, what is the way forward? What do you suggest? And what do you think will be benefiting the child?
So Yeah, again, it comes back to the main important thing. For me, the evaluations are not that important, especially at early age. I think intervention is the only way forward. Like early intervention is the key. Sometimes parents will come, I want a developmental assessment, and the child has been recently developmentally assessed. So if I don't see many differences, I don't even would want to indulge in another evaluation. Again, parent have to be counseled very well that the only thing which will make the difference will be the early interventions. I just quote an example. I just met a child who was 3 years and 8 months, and the child is going through a developmental assessment. We've seen that development has mild delays. Uh, the cognitively the child looks fine. We also did a cognitive battery on him, but you can see early signs of learning difficulties. So development, Dr. Manchanda has already spoken, but there could be early signs. This child actually has some speech and language delays. The communication is very clear. He speaks in small phrases, but his storytelling, his answering question, the comprehension aspect is limited. And when you see his writing ability, so again, the tripod grip, visual spatial areas, these are the challenges. So what is the early signs of learning disabilities? Your language is delayed, your eye hand coordination is poor, your visual spatial areas are deficits. So this child maybe doesn't have a prominent delays at this time, but if we will neglect and if we will not work on the areas where he's having deficits, he may end up having little more reading disabilities or writing disabilities. So early intervention is the key. And I think once you explain parents exact parameters, they are more than willing, because end of the day, these services are expensive. Parents have to pay for these services. These are not, schooling is something in India we have to pay because we don't get a good public education, so we have to pay for that. So if your child has any delays, then it does add to the parents expenditure. But again, early intervention is something which, if you let the parents know, if you will work right now, it will really help the child to gain skills, and down the line the child will not have any significant disability.
Yeah.
So early intervention, I think, is the message that needs to be
And we've
reassured.
seen so many, positive results of it. We
Absolutely.
work so closely with these children that so
Absolutely.
many children fade away. I mean, so many, symptoms fade away and the children recover so fast. And yeah,
I'm just stopping here because I personally believe, and when I was in US, my mentor always said, I want to write a book of end of special education. Why? She used to say, focus on early interventions. If a child is not able to read, and if I will start early and make the child reader, the dyslexia goes away. There will be some children who have severe disabilities, but that percentage will be 4 to 5%. But 10 to 15%, if they have mild problems, and if we work, they can be fully mainstreamed and they will learn how to cope with it.
I
So
totally
yeah.
agree with you. And Satinder, since we have a lot of teachers here with us, so any red flags that you can tell them that they can take care when they're dealing with younger children at the school level?
So, teachers have a very important role. The few suggestions which, being in a professional setting, I would give to them: one, be aware of early signs of, red flags, what you see, development delays. I think not giving too much information to the parents, in the sense, don't start labeling the child. I think if you see there are some development delays, tell the parent, make them aware that there is help available in this area, and you should look into these things, or give them a good literature for them to read and see how they can get help, rather than telling, ये तो बोलता नहीं है, इसको autism हो सकता है, ये हो सकता है. Don't label or give the diagnosis. The other thing is, don't reassure parents also. If there are 3-year-old not talking, we don't know what it could be. So I, as a layman, whether I'm a friend or a family member or a teacher, I would not say bol padega. In today's world, when there is help available, I would say we'll do really injustice to somebody who might be having autism symptoms. As a parent, I was just looking this reassurance from the other person कि हाँ ठीक है, कोई problem नहीं है तेरे बच्चे में. But if I gave that reassurance and the child really has a problem, then I think I became a part of the problem. So I think letting them know, seeking right help at a right time is recommended, and let the professional say there is no problem. I think that's the best thing I would do as a parent. So as a teachers, I would say, don't label or don't reassure parents. If you see there are delays, please advise them to seek help, and please be aware of a right developmental milestones being a teacher, because that's really important. And a little more effort from the teacher side can make a lot of difference in the child's life. So it's a Teachers Day. Happy Teachers Day to all of you. But teachers make a really, really impact on children's life.
Yeah, and have so many times seen that when the teacher is a little vigilant and aware, and we start dealing with the child at early stages, in fact, where the labeling is not done, the labeling is not required, but there are milder symptoms of any disability, they just go away. The child
Absolutely.
recovers in few months' time, and that stimulation is the only thing we feel was missing. Sometimes
Absolutely.
through the teacher, sometimes stimulation by the parent, sometimes stimulation by us, and the child is absolutely clear there is no. That is why when the parent comes to me, I said, please do not bring the child to me with a label.
Yeah.
Let us
Yeah.
work and see. If
Yeah.
it does not work, then we go ahead to the next step.
Yeah.
As we have been discussing early intervention, not you, not me, even the research says that is very, very helpful.
Absolutely.
It improves a child's development, and it is, services include a variety of options. It is not only when the child is late in walking, talking, but also moving, learning, reading, writing, interacting, socializing. Anywhere and anywhere we can actually start early intervention. And
Absolutely.
earlier the better. We have always listened to this phrase, earlier the better. And intervention, I definitely agree that earlier is better. But also sometimes when the parents are late, they should understand even then intervention is helpful. I
Absolutely.
have seen, I will like to, quote an example here, wherein I got a child who was 9 year old,
Hmm.
9 year old child who had autism and had not taken any therapeutic intervention. That child, when was given intervention, could absolutely read and write and start working, and more or less got integrated into a school, mainstream school. So intervention is always helpful at any stage, but yes, early intervention is the key to success for everybody. So I think this has been a wonderful session and would have been wonderful takeaways. So before I ask both of you to end up with a note, I would want to quote something that Pablo Picasso says. It's a wonderful quote, and I want the people to. It's not on early intervention, but then related to early intervention. He says that our goals can only be reached through a vehicle of a plan in which we must fervently believe and upon which we must vigorously act. There is no other route to success. So I think it is so beautifully, it can be integrated into the stream of what we have been talking about today. That if you have to be doing the screening, then you must have a plan. Like we go by the IEPs and individualized educational plans. The parent also need to curate a plan in his mind and in his life where he should believe in the child, because we have heard that the child who believes in himself, a parent is there who believes in the child first. So you need to believe in your child, and you must act spontaneously and quickly. You should not wait to take action. So that is, I think, really where we say that intervention is important, and earlier the better. So I would
Absolutely.
want, if Dr. Sunita is here, her also to give us the last word, and then you too, both of you. I would want you to end up by giving a message to all the viewers.
I think I would only say that parents can make a huge difference in a child's life. Having said that, measuring development and evaluation, I'm a parent myself. I would never want to compare my child with anybody. My child could be artist, my child could be musician, my child could be excelling in the academics. There is no competition about it. So every child is different. All we need to do, we have access to a right kind of a medium for them to blossom the way they want to blossom. So absolutely, I think enjoy parenting, and that's what I tell all the parents and whoever parents are here. I think parenting is the most precious thing. So let's not just ruin it by comparing our children. We should help them blossom to the best they can. So enjoy parenting. That would be my thing. And thank you for having this forum. And I really like the name, and continue doing more awareness among the parents. I think that is the most required thing in these days.
Let us do a poll and see how much we could relate to the parents and the people here. So I'm going to give you another poll. Just a sec. I'm very poor at it, so just give me a few seconds. I'm not at all comfortable with the technology. So yes,
But
the
you're doing
last
great,
poll is,
Vinita.
do you feel early intervention will benefit children in need? I'll give them a little more time because this is a very important message that they should carry. So let us see the responses. Hmm. Okay, so I'm going to end the poll now and share the results. 87% people say that yes, early intervention will benefit children. 6% say no, and 6% say can't say. So I think we have achieved the target by saying that, 87% could understand that yes, early intervention is important. That's a big deal for us. So the last word from me, I think Dr. Sunita is not there, is again reinforcing what Satinder said, that please enjoy parenting. Please let your children feel that they exist, they matter, and let them be, what kind of individual they are. Respect their individuality, that is most important. And I generally end up my sessions by a quote by Dalai Lama that I really love, that give them, roots to grow and give them wings to fly. So give them wings to fly, give them opportunities to explore and experiment with their lives, and give them roots to be grounded, to be, grounded means it is a long plethora that we can talk about value system, we can talk about rules, we can talk about responsibilities. So help them grow and help them be grounded. So thank you so much, Satinder, for being here. Dr. Sunita is not here, but I'll convey my thanks to her. And thank you all the participants. And I wish and I hope that you will understand how important early intervention is. And so Satinder, me and Dr. Sunita have been working so closely with children. It is not only through the research or the content that is available that we say that early intervention is important. It is by the results that we get, it is by the responses of our children whom we work with, that we can really vouch for it, that early intervention will bring a difference. Thank you all
Absolutely.
so much,
Thank
and
you so
a great
much.
day and a very happy Teachers Day to everybody. Thank you all. Bye bye.
Thank you. Bye bye. Take care. Thanks.